Welcome to Preparing for the Unexpected. Today, we're going to talk about business continuity and some emergency management in the healthcare industry. And I'd like to welcome to the show today for her very first appearance after a long time trying to coordinate schedules, shall we say. I'd like to welcome the manager of program and readiness at Emergency Medical Assistance Team, Nicole Pinto. Nicole, welcome.
Thanks for having me, Alex. And we finally get to connect and chat
Yes,
after multiple attempts.
yeah, it's finally happening. And let's not tempt fate. The last time for our viewers and listeners, we had an internet outage after we began, so we had to reschedule even from there as well. So let's jump in. I've got a couple of questions to ask you. Now, you're in the healthcare industry, so I'm wondering, how does business continuity help with healthcare, considering people like me in organizations see healthcare as something we always turn to, but you also have to do business continuity on your end. So how do you go about doing that?
Yeah, well, there's healthcare is it's a critical infrastructure, right, for Ontario and Canada, and it's always expected to be there, even in times of need, especially in times of need. So, business continuity in healthcare, it's important, as it enables for critical services to continue during times of disruption or disasters. It allows for patient safety along with protecting critical infrastructure processes, ensuring that regulations and all that are upkept when things need to be or actions need to be altered. It also allows for, critical services such as like not necessarily downtime procedures, but like also just there are fees and all that, and all of the things that encompassed your operations, such as surgeries and everything. It ensures that it can continue.
Who do you talk to help build some of these plans and processes and communication protocols? Because I think a lot of people would think right off the bat it's doctors and nurses, but I know doctors and nurses are continually busy. So who do you pull in to help create these processes and protocols?
Yeah, so of course, generally doctors and nurses, unless they are in senior leader positions, are generally your operational part of your operational team. So they're the hands-on individuals. They'll be the leaders on the ground. But for creating a BCM program or BCM emergency management program within a healthcare setting, so you can take this as within hospital and also like public health. You want your senior leaders to be part of that steering committee and that committee to drive that force. So you want them, on your side and on your team. So within your governance structure, you're looking at various policies, and then ensuring those policies, that program fits within the organization's mission, vision, values, and ensuring that those key leaders within operations, human resources, IT, logistics are all part of that and all part of that steering committee to help make those decisions for the program.
Do you reach out to the doctors and nurses? Because just so that there's alignment between the two, the front end, which is the side we see, the doctors and nurses and the healthcare professionals out there responding to events. But then you've got the behind the scenes people, and a lot of them are who you're talking with. But do the two actually come together to make sure that, hey, we're in alignment? So if something happens to our organization or there's a community event, we're still in alignment.
Yeah, so seems like most programs, you should be connecting with your staff and employees at various stages, right? So during the creation process, or but also during testing. So when you're doing any sort of exercises, or and testing through smaller scenarios, and sometimes there are specific, like just scenario based within like specific clinical teams, or within like other teams also, not just clinical, but like within your IT teams, and going through various scenarios, you're always connecting with these individuals to ensure that the policies, operational procedures and plans and all that you have in place work. And if there needs to be any updates, then you take that feedback through any sort of after action review or survey, then, and you implement that within the program.
Yeah, it's really, really important so that everyone is in alignment. And, like you said at the very beginning, you're a critical service, healthcare, and that's what public views, doctors and nurses and everyone in hospitals and clinics as, you're critical. So how important is it to build networks with communities?
Super important. I think we all know within like the emergency management business continuity field that if you don't have relationships established prior to or within planning, then you've kind of failed. When you're trying to do it during a response, you don't want to do it necessarily during a response unless it's completely new, vendor or something that you've met for the first time. But generally, you want to keep and you want to build those relationships during the planning phase, because you want to know what resources you have. You want to know who's there to help. I can tell from my team, because we can deploy cross-provincially, that a lot of the times if we do need anything, we have a phone call like with someone who's in our address book already, and that we've had, years of experience with. And it's so helpful, especially when you're going to these different situations. So it's important to have those connections to ensure that you have a more effective response, and effective planning, so that you know what these individuals or these companies have at hand that can support you when that time comes.
You mentioned testing earlier on, and you just talked about your building relationships with various vendors, across the province of Ontario, and I'm sure other provinces do that too. Is that when you start to bring some of these teams together and we hear about these big simulations at a hospital and they're covered by the news, and you have a quote unquote paid actors to pretend they've been injured? Is that a way of building the network, relationships as well, is to involve these people in your tests?
Yeah, so sometimes like I can give you an example from our team. Sometimes we'll use like paramedic students or something. So it gives them it, depending on the individuals, and in many cases, like I think we will take also Pearson whenever they have their annual exercise, they'll get community volunteers. It's a great way to build knowledge and understanding within the community, within the various groups that you are working with, or that you're supporting, to say, hey, this is the program that we have, and this is what we're doing. This is, you get to learn a little bit more about the team, the organization, what they do, what protocols might be in place. So it's various scenarios that like you have these individuals involved either as volunteers, or you can have community as involved as volunteers, where the vendors might actually be players, active players within like an OC or supporting role or something. So it really depends on what the scenario is.
And I guess that's one way for the public to increase their awareness and involvement as well, which will help health services. Health services learn about public expectations and vendor expectations, and it really just builds that network, as to so that you have better responses based on a scenario.
Yeah, exactly.
I always hear about these big tests after the fact, and I've always wanted to play, dead guy number one or something, just so that I could watch and see what's going on.
I'll keep that in mind for next time.
Please do, please do. Now, uh, I mentioned at the very beginning about business continuity and emergency management. There seems to be, at times, the two were going into different paths. They used to be together and then going in different paths. And now there seems to be, the roads are coming closer again. There in emergency management, there's more talk about business continuity, and business continuity, there's more talk about emergency management. Do you see the two coming together, or should they stay separate?
Well, it's kind of funny because in emergency management, even though like, if we're looking at municipal emergency management, technically municipalities don't necessarily have to, or there's no requirement for a BCM program. It's a good to have, especially when you have continuity of government, or you need the continuity of government, and then you have a number of essential services that you need to include business continuity. So I think a lot of places that I'm seeing now is just, yeah, they were separated. You have a lot of positions that are either now EM and BCM, or you have, within the team, you have a specific BCM person, you have a specific EM person. But it's so important for them to come together because it's there's they have their similarities, there are differences, but there are also similarities. And, you know, one is more focused on like response planning, but also the other's focused more on like recovery and all. And I think that's important, especially this day and age with the types and the changing environment within um the disaster realm that we're seeing, the crisis and disaster realm, is that we have so many prolonged scenarios or situations, and it's just exacerbating what our organizations can actually handle. And so to, combine both, I guess, both realms into one, it works for the enterprise, right? And we see a lot of this, and we've been seeing it a lot in healthcare where it's called enterprise risk, or the focus is on enterprise risk, as opposed to just saying emergency management or business continuity. And it's very risk-based. Both sides do risk. You do your hazard identification on the emergency management side, and you do business impact analysis on the BCM side. But it's important to combine both of them because they both bring benefits and different areas, but they both also have shared goals where you're looking at organizational resilience, you're looking at, that the risk-based approach that I mentioned. There's also both work in the realms of preparedness, which I think, and it's funny because when I think about when I first actually was going into like full-time work or going into interviews and interviewing for both business continuity and emergency management roles, I was asked like, well, your focus has been on EM. How is your mind shift going to change with planning? And I'm like, well, we actually do a lot of planning in EM. So and that's where I think there's also another disconnect. So there are a lot of similarities between the two. And if we're looking at these, very long crises, the support that is required, and there's an increased focus on recovery, both aspects are needed to be effective.
Yeah, and if you're lucky enough to have one person doing EM and the other one doing BC, they're going to have a lot of communication, and that goes back to building that network as well. If those two are in line, there's going to be consistent messaging and communications built as well.
Yeah.
Now, I've got one last question for you. I know we said if time permits, but it's my show and I'm going to make time, so I don't care. So, I mentioned at the beginning, you were the manager of the Ontario Emergency Medical Assistance Team, or what you had a, what was it, EMAC? EMAT?
EMAT.
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 So can you tell us about that?
Yeah, so EMAT is a health system resource in Ontario. It was established in 2004 for post-SARS to, in the essence of building surge capacity within the hospitals. Over the years, of course, it's expanded and grown. So the team can do primary care, acute care, critical care, limited critical care support. Um, we can do patient isolation for pandemic type events or infectious disease events, cold zone CBRN decontamination. So you have different zones within when you have a CBRN or chemical, biological, radiological, nuclear response. So cold zone first receiver, what the team supports where the hospitals receive patients. And we can also do incident management advisory support or incident management response, as well as a crisis response team. So we have social workers or psychosocial response. So we deploy anywhere in Ontario. So whether that's originally it was just with road access, but we have deployed into fly-in remote communities, remote First Nations communities. So that's something new that we have a requirement of, although we've done it in the past. And we can be self-sufficient. So we have our own infrastructure, we have our own equipment, beds. So if anyone's watched MASH, we're kind of like MASH, we just don't do surgeries within our tent infrastructure. And we can set up within a tent infrastructure, but also we can also set up within a building of opportunity. And our team heavily relies on working within the incident command and incident management system. So we have an incident commander, and then we have our safety officers, or we have our own medical director, a liaison officer, and then we have our different section chiefs for each of the functions. So our planning, operations, logistics, and finance. And so within operations, we have different groups. So we have a specific specialty CBRN team. We have an oxygen team because we use ventilators and we need some of our team members at least to have an understanding of our ventilator system. It also encompasses a psychosocial team. Our logistics team is in charge of or oversees the staging, and they support the readiness and maintenance of our equipment. And they also transport our equipment and set up, demobilize, as well as maintain our campsite during any sort of deployments or training events. And then the finance side is helps me with tracking and all that. So for my side, I work on the emergency operations center side. So I don't necessarily deploy with the team. I work in our main office, and I support the team from there. So any strategic, ensuring that we are aligned with the Ministry of Health. So we deploy under the direction or approval of the Deputy Minister of Health. We are a Ministry of Health support and resource. So, and then of course our planning team supports us with like coordination of like travel accommodations, but also working on incident action planning, forward planning and all. So it's a very big project, very big operation. It can be.
You're actually living what you spoke about in the first part, because you mentioned so many different vendors and partners that you would be dealing with, and obviously all of Ontario, which is a huge place, and the different communities. You're really doing those things that you said, all the networking, the communities, the various vendors and providers and suppliers and logistics people that are out there, bringing them all together. You're living it.
Yeah. Yeah, we really are. And we're very fortunate to have, not just on my side, but like our incident management team and our incident commander and all of them, even our members. It helps to have membership from across the province, and a number of members who are well versed also in emergency management and have those connections. So it's really beneficial, especially for the operations that we have.
Well, from me and many listeners and viewers that are out there, thank you for what you do and all the people that you've helped, because I know you have helped so many and so many communities. So thank you so much for all of that.
Thanks, Alex.
Do you have any final thoughts you'd like to share on emergency management or business continuity? Any final nugget of wisdom or something you'd like to share?
Oh, goodness. Um, I guess like one of the main things that has stuck, especially like when I first started in my current place of work, I started off as an operations coordinator. It's like, don't be a stranger. Whenever you're in a meeting or a room or anything, if you have questions, just reach out and ask, or even if it's in a meeting and stuff, because that's where, that's where new ideas are built. Or different way of thinking, things that haven't been thought about might come up. And it always, stems a great idea or can.
Yeah. The only stupid question is the one never asked,
Yes.
really. Nicole, thank you so much for sharing your time and thoughts with us today. I really appreciate it. And hopefully
Thanks.
we'll have it again.
Thanks for having me, Alex. Yeah, let's try not making it too long.
A little quicker next time, I hope. Take care. Thank you.
Thank you.